What is drug-induced lupus and how does it affect people? Have you ever heard of drug-induced lupus? This is a unique condition that can arise from certain medications. Unlike systemic lupus erythematosus, which is an autoimmune disease with an unknown cause, drug-induced lupus erythematosus is directly linked to specific drugs. It triggers lupus-like symptoms in some individuals, making it important to understand how it works and what it means for those affected. Drug-induced lupus primarily impacts the skin and sometimes other organs, but the symptoms are usually milder compared to systemic lupus erythematosus. Common signs include skin rashes, joint pain, muscle aches, and occasionally fever. One notable aspect of drug-induced lupus is that the skin symptoms are often mild and tend to improve or completely resolve once the medication causing the issue is stopped. This reversibility is a key feature that sets drug-induced lupus apart from classic lupus. The way drug-induced lupus develops involves the immune system reacting abnormally to certain medications. This reaction leads to the production of autoantibodies, which can cause inflammation and tissue damage similar to what is seen in lupus. However, the type of autoantibodies and the clinical presentation in drug-induced lupus can differ from those in systemic lupus erythematosus. For instance, antihistone antibodies are more commonly found in cases of drug-induced lupus. Several medications are known to potentially cause drug-induced lupus. These include hydralazine, which is used for high blood pressure, procainamide for heart arrhythmias, isoniazid for tuberculosis, and some anti-seizure medications. It is important to note that not everyone who takes these medications will develop drug-induced lupus. Genetic and environmental factors may play a role in determining who is susceptible. For patients, experiencing symptoms that mimic lupus can be concerning. However, drug-induced lupus is generally less severe and more manageable. Once the offending medication is discontinued, symptoms usually improve within weeks to months. In some cases, mild treatments such as non-steroidal anti-inflammatory drugs or corticosteroids may be recommended to help control symptoms during recovery. If someone notices lupus-like symptoms while taking certain medications, it is crucial to seek medical evaluation promptly. A proper diagnosis involves a clinical assessment and laboratory tests to identify specific autoantibodies. Differentiating drug-induced lupus from systemic lupus erythematosus is vital, as the management and prognosis for each condition differ significantly. In summary, drug-induced lupus is a reversible condition caused by specific medications. It is characterized by mild skin and systemic symptoms that improve after stopping the drug. Awareness and early recognition of this condition can help prevent unnecessary complications and guide appropriate treatment. Always consult healthcare professionals before making any changes to medication regimens.